about tuberculosis a little bit. Algie Abdullah is going to come up and talk about DOTS Plus, a promising approach to increasing adherence to tuberculosis, drug-resistant TB, and oh, it doesn't continue here. That sentence cut off.
Good morning, everyone. Thank you very much for this opportunity. I'm glad to be here to share our experience with you. My name is Algie Abdullah. I am representing ADPP, a local NGO from Mozambique. The topic is DOTS Plus, a promising approach to increase treatment adherence and reduce mortality and morbidity for TB, drug-resistant TB and HIV. Okay, a little bit about ADPP. ADPP is a local NGO in Mozambique that is working more or less 40 years now. And we are implementing activities in all the provinces around the country. We have a staff for more or less 3,000 people, and annually we benefit 6 million of people in all the provinces, in all interventions. Besides the activities on health, mainly on tuberculosis and HIV, we also have interventions on education, environment, economic strengthening, and more. The activities are implemented, as I say, in all the provinces. In terms of approach, we implement people-to-people approach, building local capacity and supporting people to share their challenges, discuss with them, find solutions, and take actions according to local conditions, local resources. We are implementing HIV and TB activities since 1998. A little bit about background. As you may know, Mozambique is one of the high-burden countries for TB, HIV, and drug-resistant TB, and we have these numbers again. But I want just to remark that from a total of more or less 98,500 people diagnosed with TB in 2021, 99% of these people received counseling and testing for HIV. And in terms of co-infection, for DS, TB, and HIV, we have a rate of 25% of co-infection, and 95% of this population is receiving ART. Regarding drug-resistant TB and HIV co-infection, I have to say that in 2020, we had a rate of 45%, and this percentage reduced it for 38% in 2021. Well, with all these numbers, all this situation, the main challenges that we identified are related with keep the DRTB and TB-HIV people living with TB and, the main challenge is related with the treatment success for DRTB and HIV patients, both to complete DRTB treatment and to remain on HIV treatment. This graph is just to show the rate of co-infection. Well, in terms of our project, I have to say that the ADPP is a local NGO in Mozambique, as I said before, and we are implementing this USAID-funded project called Local TB Response that is implemented in 50 districts in 4 provinces in the country. To respond to the challenge that I mentioned before, we designed and we developed and we are implementing a strategy called DOTS Plus. The DOTS Plus consists essentially on providing support at community level to those patients with TB, DRTB, and TB and HIV. We have a cadre of activists in all the districts. We train them, we give all the tools for them to support these patients in treatment. Since the beginning of the treatment, each patient is assigned to an activist, and the activist is responsible to provide all the support that the patient and his family needs in a centered approach strategy. And to complement all these services that the activists provide, we also provide psychosocial support and to improve the results of the interventions. We know that people affected with TB, drug TB, and HIV, they have needs in terms of emotional support, mental support, and the activists are trained to provide also these services. This graph is showing mainly two results, but I want just to remark the blue line. All the patients, DRTB patients, they are evaluated